Family Ties vs. HIPPA by Tanis Hayden. Facing ethical dilemmas is nothing new for the characters of the hit TV drama Grey's Anatomy. In fact, facing such dilemmas has been a consistent theme over the 15 years the show has been on the air. For my fictional example, I plan on examining one of the more recent ethical dilemmas that occurred this season. At the beginning of the 15th season, Teddy Altman, one of the previous heads of cardiothoracic surgery at Gray Sloan Memorial Hospital, returned to tell her ex-boyfriend that she was pregnant with his child. Unfortunately for Teddy, she did not realize that her ex, Owen Hunt, had reunited with his ex-wife, Amelia Shepard, and had recently formed somewhat of a family of their own, involving foster children. When Teddy realized this, she decided she was no longer going to discuss her current situation with Owen and that she was going to leave and return to Germany, her current place of residence, as if nothing had happened. However, before leaving, Teddy suffered some medical complications that landed her on the table of the current acting cardiothoracic surgeon, Maggie Pierce, at Gray Sloan. Given that this show is a soap opera, the drama does not stop there. Maggie and Amelia, somewhat considered sisters by way of marriage. When Maggie examined Teddy, she learned of Teddy's pregnancy and the identity of the father. Teddy was terrified that the situation and the fact that she knew the truth, given her connections to both Amelia and Owen. As a result, Teddy felt the need to point out the professional relationship between the two and that Maggie had both an ethical and legal obligation to keep Teddy's patient information and her pregnancy confidential as the season progressed. We watched Maggie struggle with the burden she felt by knowing such sensitive information. As a viewer, I could sense the obligations that Maggie felt for both her family and her patient. In the end, Maggie caved and went against her medical oath. Maggie ended up sharing Teddy's pregnancy with her biological sister Meredith, the sister that linked her and Amelia. And sharing this information, Maggie not only violated patient confidentiality by breaking HIPAA, but she also broke the law and went against her medical oath. In considering a few thought-provoking questions, is there ever justification for intentionally ignoring a professional oath or patient confidentiality? Should violations ever be excused? Do you believe there are different levels of severity when HIPAA is broken, or is any infraction considered just as bad? Should there be a specific tipping point where someone in the field should break confidentiality? Do you consider breaking confidentiality a selfish or selfless choice? Let us ponder a few more questions. Do you consider dinner table gossip a violation of confidentiality? Do you feel that the fear of a potential breach of confidentiality hinders a patient's ability to be completely transparent with doctors, therapists, or other professionals? Does this fear play a role in providing professionals with critical information? Does it negatively impact the healthcare field? Do family or other professional relationship ties trump the ties a medical professional has to a patient? Scenario specific, did Maggie do this for the sake of her family or to unburden herself? In considering some primary ethical considerations in relation to the example that I have given, HIPAA is the United States legislation that provides data privacy and security provisions for safeguarding medical information. In the textbook Issues and Ethics on page 240, confidentiality does not apply in cases of child neglect and abuse. The professional is required to report the situation under penalty of fines and imprisonment. As professionals, we are obligated to report for people who cannot report for themselves. Mandatory reporting is evident in a case where a client would not be able to report for themselves, such as an example of child abuse or elder abuse. Serious or foreseeable danger to a patient or society. And if privacy must be broken to ensure best practices, it is always best practice to inform the client first. Here are some of my viewpoints in relation to the questions that I asked and also to the scenario. Dinner table gossip is absolutely a violation of confidentiality. I feel that under no circumstances should a client's personal information be shared with another party unless it is a situation where the individual had or has a plan to or intent to harm themselves or others. I strongly feel it should be common practice to address mandatory reporting during intake or the initial client assessment. Could this potentially hinder a client's ability to be 100% transparent? Sure, there is always that chance, but the reality is that a professional is legally and ethically held to the standard of reporting such situations where harm may be done to a person or persons. This fear absolutely plays a role in a therapist and medical professional's ability to receive critical information, but in these professional relationships, you establish rapport with your clients or patients in these situations, and I believe that established trust lessens the fear and provides individuals to disclose and communicate honestly. Family and personal ties should never trump confidentiality in a professional relationship. It is not the place or the responsibility of the provider to ever share privately disclosed information with any party without consent. It is illegal. In this TV scenario, Maggie shared this information for selfish personal reasons that are unethical in several ways. She violated the confidentiality and privacy of her client when she chose to share her medical information and violated her medical oath. There are situations where violations are necessary, such as client reporting intent to harm themselves or another individual, or a client reports any physical or sexual harm of a child or elder. Professionals should always act with integrity, honesty, and commitment to both patients and the profession by maintaining confidentiality and the privacy of their clients. As a behavioral health or medical professional, you should never disclose information without authorization of consent of a client unless it falls under mandatory reporting. Patients' well-being must be the highest priority. In my opinion, Maggie's actions were wrong and inexcusable. I'd like to leave you with this quote by Peter Bell. When confidentiality is unjustly undermined, the integrity of the system as a whole is in question.